So that was the thoracic surgery ward. Then there was the professorial intensive care unit, where we did major post-op surgery, such as any major surgery such as aortic aneurysm repairs, grafts on aortic aneurysms. Cardiac surgery wasn't done at Aberdeen Royal Infirmary while I was there. It was just going to start when I left in 1973. It's where all those, any major road accidents which involved major abdominal surgery. It was where all the surgery was done for cancer of the esophagus. Although if it was required thoracic surgery, they would be in the thoracic surgery ward. It was where I remember seeing quite a few patients with esophageal varices. Any patients who were having major major surgery for their liver, that type of surgery is where they would be seen in the professorial surgical unit. And it was just routine post-op surgery, often for days and days. Frequently, of course, being men, they were smokers, and so I had chronic lung disease, and so they always were a challenge. The other part of my run was the private ward, and this itself was a challenge because being in the British system, the private ward was quite separate. It took all and everything that was coming your way. Often the patients were very demanding, and because I was not being paid as for anything add-on, I would treat it just like any other ward, but sometimes I got into a bit of hot water because of this attitude. Sometimes patients expected far more. I saw a wide variety of patients there, and there were a certain amount of perks, I have to add. I do recall one gentleman who actually owned a whisky distillery way up in the Highlands, and he had had a stroke, and then he fell and broke his leg, his femur, and he was in traction for 12 to 14 weeks. He was a grumpy old man, but he had a charming wife. My job was to do maintenance exercises while he was in traction for the 12 weeks, and then of course mobilise him once he came out of traction, and that was a challenge, because he had also had a stroke. He wasn't that old. He would have been in, I suppose, late 50s, early 60s, but his wife was lovely. Eventually I got him up on a Zimmer walking frame, and he duly went home, and his wife invited my husband and I to stay. They owned a hotel up in Craigalchi, which is just near Gordonston, where Prince Charles went to school. Gordonston at that time was just beginning to admit girls and to the school, and the weekend that we went and had a free weekend as guests of this husband and wife who owned the whisky distillery, we were there at a time when all the girls were enrolling at Gordonston, and it was quite a cultural experience. Other sort of patients that I saw in the private ward was people who were post-op having total hip replacements. What they were doing then at that time were Charnley total hip replacements, so mobilising them. I do recall providing post-op treatment for a young woman who was having a termination, and I do recall she had to have a hysterotomy, and the baby was 25 weeks. And by today's word, of course, having worked in the neonatal unit, 25 weeks babies were viable. Not then, but they are now. I do recall that. Other sort of patients I would see, some very wealthy women were having breast implantations, and I would have to mobilise their arms post breast implantation. I do remember having to see a lovely old gentleman called Mr. Bell, who had intractable pain where he was having a sympathectomy. He had intractable pain for cancer of the cervical spine, and he was having a no, it wouldn't be a sympathectomy, a release of nerves to give him pain relief. Now, Mr. Bell was a very well-known antique dealer to Aberdeen and to the royal family too, and I do recall one day I went in to see him post-op. Of course, he was a smoker, and he had a lovely bunch of grapes on his Nightingale trolley, and he offered me one grape, and I thought, oh, that was not being very generous. And then he showed me that they had been the card that came with them, and it was from Edward H., who was the Prime Minister at the time. And I think he was the Prime Minister at the time. He certainly, if he wasn't the Prime Minister, he just resigned as the Prime Minister. And there was also a card from the Queen Mother, who used to buy quite a lot of antiques from him. When he died, his widow sent a whole lot of antique jewellery up to the ward for all the staff who had treated him, and I was able to choose a piece of antique silver jewellery that I to this day have. It was a Luckenbooth, which is two entwined hearts, which goes back to the time of, now my history's failing me, one of the earlier queens, and it is treasured, and I do remember Mr. Bell to this day because of that, his interesting guests, his interesting letters, and his interest in antiques. I do recall the other sort of patients that we saw post-op, prostatectomy, a very elderly gentleman who had a post-op. He, of course, had a chronic lung disease, and I had to do lots of post-op chronic of chest physiotherapy for him. And then I had to mobilise him on a Zimmer walking frame.